Welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Today on the show, we have Kirk Heath. He is a healthcare executive, and he wrote the Kevin MD article, "Can Medicine Transcend Beyond the Clinic Walls? I'd like to see us try." Kirk, welcome to the show.
Thanks. Great to be here, Kevin. Thanks.
So we'll get into your article in a little bit, but first off, can you just share your story and journey to where you are today?
Yeah, happy to. It's been a great journey. I'm originally from the Philadelphia area, but now live in Virginia Beach with wife and 3 kids. Went to University of North Carolina as a business major, but then somehow followed up my passion and found my way into the medical field. I was an EMT at the time. Went to medical school and then surgical residency here in Virginia, and just fell in love with operating and healthcare and whatnot. Interestingly, early in my career, maybe about 5-7 years in, was introduced to really the ROI and the healthcare kind of tech industry through implementation of EMR in our system, Sentara Healthcare. And thanks to the High Tech Act, we were sort of encouraged to put EHRs into our organization. After we did that, Sentara did it pretty well. After doing that, started a company that really did that across the country and helped other entities and really large organizations do it, and fell right into it while practicing, and just fell in love with the efficiency and that driving the ROI. I did that while I was a full-time practitioner, which is, like, in the article. I'm not sure I recommend that, but it did give me a really good experience into healthcare IT, ROI, the business of medicine, which finally led to the creation of Modio in 2014, which, I am the president now. We were acquired in 2019, and I actually dropped full-time practice probably a couple of years ago. Still cover in sort of the term gig economy. I hate putting that on physicians. It seems kind of, but sort of locums and what we call flex medicine. But yeah, that's my story. It's been a unique journey from college till now.
So I've had several physician CEOs on this show, and I always like to ask them the same question. So tell me some of the challenges that you face moving from the clinical side into the CEO side, and
Sure.
has being a physician helped or hurt you in your role as a CEO?
Yeah, that is a wonderful question, and I love answering it. There's a lot of valuable lessons learned. One of the biggest ones, I sometimes tell folks when I'm in a business meeting, I don't put MD after my name, and I don't enter myself as Dr. Heath, because sometimes it hurts. We are known as only knowing medicine, can't possibly be good business people. Why don't you stick to what you're doing? So I've learned that over the years, how to navigate that. So there are times where I don't lean on that, but there are other times where it's extremely valuable as a subject matter expert, not only as a user in some software or a clinician, but really understanding kind of both sides of the coin, whether it's like product and engineering and the limitations we have when creating workflows, or just getting that buy-in. I love nothing better than sort of eavesdropping on a sales demo, and they don't know I'm a physician, and then you hear the conversation, and then our sales team would be like, "Oh, this is Dr. Heath," and everyone's like, "Oh my gosh," you instant validity in some of these workflows. So it's great. It provides a lot of transparency in the sales process, meaning, trying to say transparency and relevancy. Like, I understand your pain. I feel your pain. That's why we started Modio. So from a lessons learned and is being a physician health, I would say, yeah, definitely overall, it's been a wonderful education, obviously clinically, but both in this sense. In the business sense, that's a completely different animal, because I'll leave it on this. When you have physicians who have an idea and want to start a business, it's hard to do both. It's hard to do both well. And I'd be the first to admit that. If I'm trying to do so many hours being an executive and then so many hours, particularly as a surgeon, you got it. Most of the time you have to pick one or the other if you want to be really good at it.
Now, you've successfully made that transition from clinical medicine into the CEO role, and I know a lot of physicians want to make a similar transition. What's your single biggest piece of advice that you can give to those physicians?
Yeah. So in order to make that transition, understand what you're asking, getting into. I got to tell you, I miss surgery. I miss operating. I miss that clinical touch, but it's a trait. I also absolutely love what I do now. So make sure it's the change you want, and make sure you understand the work it takes to get there. And then also, if you make that transition, stay grounded. Just because we're physicians and we've spent 20 years, some of us more, in longer residencies, doesn't mean that we can go into a business setting and be the king or queen in the room. It may not happen. Listen, pause, respond, take that mentality. And I've learned that lesson. I don't want to say the hard way, but I've learned that lesson over the last 10, 15 years of doing this.
All right, let's transition into the Kevin MD article that you
Sure.
wrote. It's titled, "Can Medicine Transcend Beyond the Clinic Walls?" I'd like to see us try. Now, for those who didn't get a chance to read your article, can you just walk my audience through it and share the story of why you decided to write it?
Yeah, fun article. And it outlines, COVID brought this up. And, this has been gig economies. For those who don't know what that is, that's sort of temporary work kind of all the time. And I hate to say I was part of the gig economy, but as a surgeon, all of us have something going on. Like we all have something we're doing, whether it's clinical research or expert witness or another company that's going on. So COVID really kind of brought to the forefront, can we be efficient remote? Because we were forced to be remote. The company that acquired us is 3,000 employees. We're in the middle of building another building, and all of a sudden you guys are all going home, and it's a monumental effort to get there. So really fascinating in the tech and sort of non-clinical realm. But in the clinical realm, can there be some way that we are efficient and we can do our jobs? A lot of our daily activities are, yes, we want to be next to patients, and a lot of times we have to touch them, particularly in surgery. But do we always have to? Well, we do, because that's how we get reimbursed, right? And that's such an antiquated statement. Look at telemedicine. We look at telemedicine as sort of just coming to the forefront. It's been around for a little while. I can remember, I always tell the story of the rounding robot. But for some clinicians, this was pioneered kind of with urology, and I think it was In Touch Health out in California. When I was a resident, we had rounding robots that the urologists used to visit patients. Now you had to have another clinician there. And so I wrote the article really to provide another perspective on remote medicine and in the clinical realm. And what a taboo topic. How could you possibly sit at home and treat patients? Our radiologist has been doing it for decades with PACS systems, so surgery, could we possibly do it? Can I tell if you have a wound infection at home? Maybe not, I probably need to see you, but can I see you after a post-op appendectomy? And then really driving to the limitations and benefits of it. I will get into specifics, but that's what the article outlines is what are the good, bad, and ugly of remote work for in the clinical setting.
Yeah, so from your perspective, tell us some of the challenges that physicians face practicing remotely.
Yeah, so I break that in a few categories. What I mentioned before is clinically, can we do a good clinical job remotely, right? And there are certain times you need to be in front of a patient, and there are certain times you don't need to be. Mental health is a great one. It provides more access. If you've got access to technology, or I saw one urgent care, or I can't remember the organization, where you actually got into a booth, in a public booth, and you had a visit. How awesome is that to really be able to access care? So there's great potential there in terms of sort of access and actually physically being able to do it. The struggles and some of the barriers we have is around, and it's really what I do is credentialing and licensure and privileging. And it is such an archaic process that we go through now. Attorneys go through it. They have different laws, obviously, in different states. Medicine doesn't vary between state to state. I'll be the first to say that. It's the same basic principles. Not to call out North Carolina, but in trying to get a North Carolina license, it's, part two with COVID, we're half a year, 6 months before I can get a license. When COVID hit, there were some government regulations that said, hey, we're going to expedite getting licensure. And that brought to everyone's light, like, hey, maybe there's a better way to do this from a regulatory standpoint, from a technology standpoint. That's where we come in. And really just common sense about licensure. Skip the business reasons why it's separate, skip the antiquated legal reasons from the 60s, why every state has a different, licensure process. But it's great to see new ground with the compact states that are allowing cross-state licensure and whatnot. There's no excuse for not doing that. So I think the article and really tries to bring to the forefront that different perspective that we need to push for, because no one else is going to do it except us as clinicians.
So as the pandemic hopefully winds down, we keep our fingers crossed on that, you're seeing more and more physicians go away from remote and back to in-person. So I guess my question is, what do you see as some of the lasting effects on remote care that the pandemic has brought on?
Yeah, the big one is the exclamation point on telemedicine. No question about it. I think it's, it was already on the way. No, you wouldn't have to convince anyone, but not only from the, like I said before, the access of care, but think about it, even like the protection of the provider. Like, imagine if you had remote into areas where there's Ebola or another, SARS virus or whatnot, and you don't look at everyone, all these guys putting themselves at risks going into some of these, ICUs. So I think that remote capability works well. Even, if you think about it, even in intensive care units, what used to be the VisiQ doctors, I think was the name, where you've got the ICU docs monitoring 20 beds at night and doing a great job of doing it. So I think that's some of the lasting things that will stay with us, is we really can clinically, there are some things we can do remote. And I think from a satisfaction and living and, quality of life, that may help with some of the pressures that, our colleagues have been under, in this grueling environment. So
now, from your perspective as the head of a technology company, so what's coming in the horizon in terms of remote care? What's coming in the next couple of years?
Yeah, it's funny. My from being in technology on my side, we're pretty straightforward: credentialing, privileging, licensing. But I'll talk about some of the other. Look at remote robotic work that's being done, with the Da Vinci and folks operating across the ocean or from an office. I think that's really, really fascinating. The telemedicine and the really progressive vision of some of the, I'll call them primary care, urgent care. You probably know the names of somewhere in the country, of just their new technology approach to primary care. I mentioned one, which I can't remember the name. It was the sort of the box, but there's some out in California and across the country where it's even electronic scheduling, even making sure that when I get there, I'm going to be there on time, and the provider is going to be on time, instead of, just show up at this time. And those groups that adopt that, and those, health systems that adopt that, are going to be the ones that succeed financially and also with patient care and patient experience, because that's such an important aspect. So I see that coming down the horizon. What I want to see, obviously, in my area, whether it's our company or one of our, awesome colleague competitors, is really streamlining the credentialing process and streamlining, why does it take 90 to 100 days to get me privileged into a hospital? I can tell you, but it will take me, another 20 minutes. But let's figure out better ways to do it by better data management, things like that. So I think technology, obviously, I'm a big believer in assisting in our process.
Now, in terms of licensing, is there any movement towards, say, a national license?
Yeah, so that's the Compact initiative. And so there's a fair amount of states, and I'm sorry, I don't know the number, but it's growing, where you get one license in one state, and instead of it is 90 to 120 days before COVID. Some of the licensure, it's like 6 months. Yeah. But these compact states, it's a much shorter application. The due diligence has been done on the provider. And I got to tell you, the plug for these is the reason it was done is the right thing. We want to make sure we're providing providers who are safe and have demonstrated to be safe, right? I don't want to skip the line in doing that, but there's definitely progress in doing that. I think, again, COVID and the legislation that came out, the previous administration, where they expedited that, to look, let's skip all this, let's get our needed providers in, even our own hospital, let's get them in there. There's definitely a way to do it, and it's definitely coming down the pipe.
We're talking to Kirk Heath. He's a healthcare executive, and he wrote the Kevin MD article, "Can Medicine Transcend Beyond the Clinic Walls? I'd like to see us try." Kirk, what are some of your take-home messages that you want to leave with the Kevin MD audience?
Yeah, and I love my colleagues tremendously. Like I said, I do miss practicing, but healthcare is such a fascinating industry on the clinical side, the tech side, the business side. And I think what I'll leave with is really don't be afraid of new or different perspectives. I've learned that from an early age, and I think it's been a strength. And this isn't a political stance, but we may not agree. There's value in every perspective. I mean, whether it's political, healthcare, vaccine, or everyday life, I just value the power of that different perspective, because all of us live in a little bit different light, but we got to come together and do it. And I think in healthcare and in starting a company and in tech, it will only improve your chances of success in delivering your message.
Thank you so much for sharing your time and insight. And thanks again for being on the show.
You're welcome.